Rural Health Association. Got an excellent lunch and learn for you all today, so I'm glad that you were able to join us. Just a couple quick housekeeping items before we get going here. If you do want to ask a question during today's presentation, please use the chat or Q&A function. You should be able to find those by hovering your mouse either at the top or the bottom of the screen, depending on which view mode you're in. They will pop down or pop up, whichever view. We will keep an eye on both the Q&A and the chat, so whichever you prefer to use is just fine. Kathy Walker and myself will try to keep an eye on that while our MCEs present today, and jump in as necessary. We'll also have a little bit of time at the end for questions. Also, we will record today's session, so if you can't join us for the full hour, it will be available on our YouTube channel probably by the end of the week. Or if you want to share it with one of your coworkers that was unable to attend, please do that as well. So without further ado, I think I'll go ahead and turn it over to you, Kathy.
Okay, thanks, Allie. Appreciate it. My name is Kathy Walker, and I'm the program coordinator for Connecting Kids to Coverage. And with me today is our program director, Tina Darling. And I'd like to go ahead at this time and introduce our speakers from the 4 managed care entities in Indiana. And I'm going to go alphabetically by the MCE organization. So just because, so we have Katie Rodriguez from Anthem. She's a community relations consultant. And then we have Jeffrey Galbraith from CareSource, and he is the community marketing representative. Next, we have Rachel Maxey from MDWise, and she is an outreach supervisor. And then last but certainly not least is Jessica Parks from MHS, and she is a community relations representative. So at this time, we'll go ahead and turn it over to Katie, since she's with Anthem, going alphabetically, and we'll give you an opportunity to speak about your MCE and the services you provide and the importance of those. We're looking at, defining managed care entities, identify steps applicants can take in selecting the best one for themselves and their family, and then examples of when to connect with an MCE and contact information for each are our objectives. So go ahead and take it away, Katie. Thank you.
Wonderful. Thanks, Kathy, for the introduction and for inviting us here. I'm going to share screen, or at least attempt to. And yeah. Okay, everybody should be able to see. So yes, as Kathy said, I'm Katie. I'm the community relations consultant with Anthem Medicaid. I primarily cover South Central Indiana, but in today's increasingly digital world, I am able to help anyone from wherever you're viewing. So thanks for inviting me. I'm going to just briefly go over what Anthem offers its Medicaid members and the local community. Anthem is proud to manage care in several states. Each state can vary in its eligibility process for Medicaid, but it is nice that for people who move, between states, that they might be able to at least recognize a familiar choice in who manages those benefits. In Indiana, we offer Hoosier Healthwise, Healthy Indiana Plan, and Hoosier Care Connect. To enroll, they can call or do the application online, and when they do, they can select Anthem to manage the benefits. The eligibility process can be overwhelming, especially if it's their first time or if it's a complicated case. So we always recommend when we're talking to folks out and about that they connect with a health insurance navigator in their area to help them through that process. Once a member gets through the application process, if they've chosen Anthem to manage those benefits, this is what they can count on. So we have a large network, and we try to make it as easy as possible to find a doctor, change doctors. If they've chosen HIP Plus and are paying the power account payment, which is usually between $1 and $20 based on their income, then they would have vision and dental, and also access to chiropractic, no copays at the pharmacy, and would not need referrals for things like behavioral care and family planning. They also get a variety of free extra benefits. These are designed to sort of help remove barriers, help members reach their health goals. We just recently added to this list. So for the most up-to-date list, we would encourage people to check out our website. We still have favorites like the transportation that we offer to doctor's appointments, WIC appointments, FSSA appointments. Still have the gym memberships, Weight Watchers memberships, Boys and Girls Club, high school equivalency assistance, free tutoring for children in foster care, SafeLink cell phones, so much more. But they've recently just added a lot of benefits for our Hoosier Care Connect members. Things like gas cards and money for exercise equipment, enhanced vision, caregiver toolkits, and lots more. So again, check out the website for the full list. And those are in addition to just the rewards programs. So we're also going to reward members with money that they can earn for doing preventive care. They can spend that money at CVS, Family Dollar, and Dollar General. That again is also subject to changes and we're always updating. So the full list again on the website, but it's up to about $300, I think, a year that somebody could be earning. And one extra fun thing is we've partnered with the Indianapolis Colts and we have a program called Blue Ticket to Health. So this is incentivizing the yearly checkup. Members ages 3 and up who get their yearly checkup will automatically be entered into a chance to win prizes like Colts tickets, Colts merchandise. And what's really nice is that if somebody in the household wins, everyone in the household is going to win that prize. In terms of clinical support, we have wonderful resources for our members. We, of course, have the 24/7 nurse line, which is exactly like it sounds. It's access to a registered nurse 24/7 who can talk about medical conditions, treatment, guidance as to where they need to go if they're unsure about whether or not to see their primary care, urgent care, or ER. Care coordination. So if a member has a chronic health condition, they would either be offered case management or they can call in and request it. Case management would give them access to even more benefits. For someone who might have depression or ADHD, substance use disorder, diabetes, a high-risk pregnancy, we would have people there who could help them specifically with that. And that's a great option to have a case manager who can help you coordinate appointments, help them take care of some of the things that might otherwise be barriers to receiving care and focusing on their health. So those were the resources for our members. We also offer things just for the wider, broader community. One of those things is health education workshops. So you don't have to be a member to attend one, and we won't push membership. These are just opportunities for people to come together, maybe learn something new, talk about their health goals. Any community group can also request it for their group. I've done them in housing authorities, schools, reentry programs, church groups, you name it. We can also attend events and set up resource tables so that we can talk to people and help them understand their benefits, help them get connected to all these internal resources. Again, anyone interested in any of that would just have to get in touch with me, and I'll have my email on the last slide. So one of the great ways to stay connected with us, have the most up-to-date information, is that Anthem website. We recently just updated it again, trying to always make it easier to navigate and more intuitive. There's also the Anthem mobile app. If members can access those two things, then they wouldn't have to worry about not having their member ID. They could make payments, change doctors, manage prescriptions, but we do sort of lean heavily on our community partners to help spread the word and often to kind of help us help our members. You can also follow us on Facebook at Anthem Medicaid. There they're going to share important health information, reminders, and also some pictures of all of the things that we're doing in local communities around the United States. We encourage our members to attend what we call community member advisory committee meetings, as well as our community partners. We have community partner advisory committee meetings. those are opportunities for everyone to tell us what they think, what sorts of needs they're seeing in their communities, issues that they're having, and that's how we improve our services. So the feedback that we receive, it really does impact how we operate and the resources that we'll offer our members. If anyone is interested in hosting one, we would love to partner to do that. You can just get in touch, or if you've got another Anthem contact, get in touch with anybody at Anthem. There's no wrong door. And last but not least, the member services number. It's also going to be on member ID cards, along with all of the other important numbers for things like transportation, dental. If anyone needs interpreter services, they can call member services and request that too. And if anyone has any questions, that's my contact information, my email address. You can reach out to me. I'm pretty good about responding. And with that, I'm going to turn it back over to Kathy.
Great, thank you so much, Katie. That was very informative. Next, we will go to Jeffrey Galbraith from CareSource. Jeffrey?
Yes. I am not getting the drop down for the screen share.
Are you in full screen mode, or
I am.
are you? Okay. Why don't you exit full screen mode, which should be an option at the top. And now hover at the bottom and some options should pop up, including a green share screen button.
There we go. Okay.
That's the fastest way to get there.
All right. So with CareSource, our motto is covered in kindness, and we kind of achieve that. We strive for that with our members. CareSource, our mission, we've been around for nearly 30 years. We are a nonprofit. We serve 1.8 million members in Georgia, Kentucky, Ohio, West Virginia, and obviously Indiana. We are in all 92 counties in the state of Indiana for our marketplace, and then for our HIP and Hoosier Healthwise. And quick facts about us. We're a diverse company, and that helps us serve the diverse population of Indiana. We are a nonprofit. We pride ourselves on being very community-based and member-centric. We actually have an entire team of people just designed to help people navigate through the social service spiderweb, as they call it. We'll talk about social determinants of health in this conversation. And this team is actually designed to help address those and help our members overcome obstacles. We also have a large hospital network around the state, and doctors, providers all around the state. As you can see, we do serve the Hoosier Healthwise HIP marketplace, and then the dual eligible D-SNP population. Enhanced benefits. So just like Anthem, and I'm sure MHS and MDWise will discuss it too, case management is huge within the MCE realm. We're dealing with a population that has issues, behavioral health, it may be from the social determinants of health, underlying health issues, or just food deserts, lack of nutrition, whatever it may be. So once you get into the case management and our Care for You team, you have medication therapy, disease management, just like what Katie was talking about, asthma, ADHD, behavioral health, you name it. There's a ton of different things that can happen to people that need ongoing treatment. Care for You is our group that does our case management. They can help. This team is so awesome. They can help with medical equipment. So you have DME needs, you have housing, other basic needs, just over the counter. Transportation is an issue around the state. Doesn't matter which counties you're in. So rides to the doctor for our Hoosier Healthwise and HIP. And then you go into the pregnant members, where we'll provide transportation for WIC visits. it's a need that is not addressed enough, in my opinion. But the MCEs, I feel like we all four do a pretty decent job of providing that transportation and making people aware of it. With CareSource, one of the fun little perks that we have is our banking services. So we have express banking from Fifth Third. That is a no-fee checking account. So members are given a debit card, and it's just a free bank account. So sometimes people need that extra help that their credit won't allow them to get a bank account. With the express banking, they can do that. And then one of the questions that we were supposed to address is when to contact your MCE. So with CareSource, we do have a mobile app that takes care of a lot of different concerns. So you'll have members that they need to call into their MCE to change their address, or because they lost their ID card, find a doc, whatever it may be. All of that is actually available on our app for free to our members. And then to go into our member rewards, we have health needs screening. So when you become a member, we reach out to you. We have an internal team that'll reach out to you within the first 90 days. And it's a very generic questionnaire, but it helps us get to know the populations that we serve. And through that, just by completing that in the first 90 days, we will send you a $20 Walmart gift card. My Health is another benefit to the HIP population. So there's different wellness activities. Members can earn up to $300. The next two are the ones I really, really love. Our Babies First program. So within the rural communities of Indiana, it's highly underserved for the maternal health aspect. And I think most of us are probably aware of that. And we sit in many meetings throughout the last few years as the governor has made this an initiative of his. So within CareSource, we have our Babies First program. So moms can enroll, or moms-to-be can enroll just by doing basic things, going to the doctor, keeping up with your appointments. They can earn up to $200 in gift cards. It's a great program. And that used to be it. About a year ago, we rolled out Kids First. So just by making sure that you're taking the kids to their vaccinations, to their annual checkups, whatever it may be, 18 months to 18 years, parents can now earn more rewards just for taking their kids to the doctor like they're supposed to. You know, it's a hard thing to do, especially this last year. I think I've seen many stats of people not going to the doctor like they should have. With this, there's at least a financial incentive. So there is an external reward for that. Our outcome team. So this is the maternal child health team. I really love this team, and I cannot wait to get back to the baby showers, because that is a service that we do. Is we host community baby showers around the state. So the priority, obviously in Indiana, our numbers are not always great for the maternal and child health outcomes. So the outcome team, they focus on this education. They go out and are constantly working and educating and making sure people are getting all the care that they need. Their case management, I can't even tell you all the things that they do, but it's a team that I'm really, really proud to work with on a regular basis. Care for You, this is a team that saves lives. And it's always a tearjerker whenever they get up to speak at our all staff meetings. So this is the one-on-one attention. This is what people need, where they have the diabetes, asthma, high blood pressure, ADHD, whatever it may be. So this is the team that is making sure that people have all the DME, they're getting their medications, they're getting their appointments set up, and they're getting to those appointments. So this team really works endlessly. And it's a really awesome team. They're just so busy that I don't get to work with them too often. The transitions team. This is something that CareSource has done a huge push for in the last couple of years. Is we have done transitions. Basically, there's two transition teams that we work with. This team is the emergency room diversion, the medication therapy. So basically, they're making sure that everything is taken care of as you're getting released from the hospital. So they do the medication review and follow up, and then address the gaps in care which is most likely what a lot of our participants today are part of. Then our life services team, this is a team that I feel like we're probably the only MCE that offers this. So we do a very holistic approach for our members. And this is where the social determinants of health really come into. This is a sustained impact, and it really is a sustained impact. So this team enables our members. I don't want to say they do the work for them, because the members still have to take the initiative themselves. But just by enrolling, this team takes a look at the social determinants of health, which we have listed here. So if you have somebody that is having constant health issues and they can't afford housing, they need better education, they live in a food desert, whatever it may be, this team steps in with certified life coaches and takes a look at the situation that they're in, and then finds the immediate needs, and then how to stabilize those and how to address those needs to create a long-term success. Basically, they want them to move off of a position where they need to have Medicaid. So our best outcome is we lose a member. This team has had over 6,200 interactions with their members, 341 employed, and this team will come in and they will get you certification in IV Tech. They will take short-term goals and figure out how to evolve those into long-term goals. We've had one person, when I talk about the transitions, there's another transitions team that I didn't get a chance to address in this presentation. We've served the reentry population, and we have a team that works with reentry. And once people are getting out of prison, they meet with them and they figure out how to integrate into what the reentry population needs, and then move them into a life services contact. So we've had one person that he just got a cooking certificate and then moved that into, last I knew, he was working for a hotel in the kitchen doing massive catering gigs. So he discovered a love of cooking when he was incarcerated and has turned that into a career. So we have people that match with employee partners all around the state. It's two gentlemen that's all they do, is they're in constant contact. And then we also have 71% of our members have retained employment. So it's giving them that boost they need to reach financial stability, which will in turn help health outcomes. And then our final portion that I want to go into was our marketplace. Our marketplace, we are in all 92 counties. And obviously under the Biden administration, there's been a new push for this. So if you're dealing with marketplace populations, and this is for navigators, in our case, we do utilize brokers, people are needing to kind of re-enroll because our prices have dropped since the open enrollment period. So all these things are just kind of the benefits and the perks of having CareSource as your MCE. So if you have any questions, I will actually put my contact information in the chat, but I believe that is it for me.
Thank you, Jeffrey. Appreciate that. Very informative. Next is Rachel Maxey, and I apologize for mispronouncing your last name, from MDWise, and we'll turn it over to Rachel now. Thank you.
No worries, no worries. Hello, my name is Rachel Maxey. I'm the Outreach Supervisor with MDWise, and let me share my screen. Okay. So MDWise, we are an Indiana-based nonprofit health managed care entity serving low-income Hoosiers. We provide benefits for the Hoosier Healthwise program and the HIP program. We've been around in Indiana since 1994, so about 27 years. And our policies, directions come directly from the state, provider organizations, community partners, and participating providers that we work with in the community. And we are NCQA accredited since 2009. And just a quick overview of the programs we provide. Hoosier Healthwise, I'm sure everyone knows this, is a Medicaid program that serves Hoosier children under age 19 and also low-income pregnant women. And the same for the HIP program, or not the same, but we provide affordable health insurance plan for individuals 19 to 64 who are at 138% of the federal poverty level. For both Hoosier Healthwise and HIP, individuals can apply through the DFR number, going online and applying online, visiting a navigator at a local health center, connecting with Covering Kids and Families. Different organizations will connect members to get assistance to sign up for Hoosier Healthwise or HIP for themselves or their families. And I always like to let individuals know when they are going to apply and they aren't sure which MCE that best fits them. I always advise them to talk to their primary care provider that they plan to see or have been seeing to make sure they stay in network with that particular provider if they want to continue going there to be seen. So I always direct the best way to know which program to or MCE to go with is who does your doctor see, and then do a little research into those MCEs to see which is the best fit for you. Some special programs that we have here at MDWise, and we're constantly trying to come up with new ways to better our members' lives. We do have the 24-hour nurse on call as well. We have transportation services for our Hoosier Healthwise and HIP state plan members through our RideWise. We have Bluebell Beginnings for our pregnant moms. We do have care management services that's available for anyone that needs it, especially if they're dealing with any medical issues and things and they need that extra help just to make sure they're getting the care that they need. They can get a care manager assigned to them. We also have came out last year with a new program called SaveWise, which is a discount program that we are providing for our members. They can find thousands of different discounts on car maintenance, entertainment, just a variety of different savings that they could find to assist them with whatever they're needing. We also have a rewards program that we provide for our members to encourage them to get in for those preventative services and doing different activities to earn points towards gift cards. They can sign up for a member portal account, and they can also communicate with customer service through their portal account. When they complete their health needs assessment, they earn points for that. Mammograms, A1C level screenings if they're diabetic, if they get their flu shot, dental exams. We're definitely encouraging everyone to get in for those preventative dental checkups and things. Gym activities, they earn points for going to the gym. And also their points can be used towards their PAC payments. So that's a benefit of our members participating in the rewards program. And of course, right now with everything on a hold, normally we would encourage our members to always open their mail from FSSA or from their MCE just to make sure that they're not missing any important information or missing any important information that's being asked of them. And also it's very important that we encourage our members and everyone to always report updates and changes with their information. So whether it's household changes, income changes, even if a phone number changed or they moved, it's very important that they contact their MCE and the state just to notify us and the state of those changes so we can make sure we're getting their information to them correctly and on time. And to end off, I just wanted to provide our MDWise customer service number. Members can call in anytime. If they have benefit questions, they need to change their doctor, they received a bill, anything that they're having issues with their coverage, they can contact us. And also we have our MDWise website. Again, if they create their member portal account, they can contact and communicate with customer service straight through their portal, or we also have a MDWise app, mobile app, where members can pull up their ID card in case they haven't received it yet, or find out their benefit information while they're at the doctor. And that's it from me. And I will put my contact information in the chat in case anyone needs to get a hold of me.
Thank you, Rachel. Appreciate that. I think you'll need to stop sharing.
Yeah.
No problem.
Stop sharing. Oh, there you go. Sorry.
No problem.
I have two screens and it was on the other one.
Completely understand. Appreciate it. Okay. Jessica Parks is next from MHS. Jessica, take it away.
Awesome. Thank you so much. I'm going to share my screen. You all should see my presentation, correct? Awesome. So good afternoon, everyone. My name is Jessica Parks. I am the community relations representative for the outreach team here at MHS. And so thank you for having me. I'm just going to go over, obviously, the programs and services that we offer as a plan, and then we'll see if you have any questions. Maybe. So who is MHS? So we are a health insurance provider. We have been proudly serving Indiana residents for over 25 years. We do have products that are in the Medicaid line, the Marketplace line, as well as the Medicare Advantage or Medicaid line as well. And so this diagram here just shows you MHS overall and the products that we serve. So again, I mentioned Medicaid. That's where you'll find us for Hoosier Healthwise, Healthy Indiana Plan, Hoosier Care Connect. For Marketplace, you will see And Better from MHS, where we offer an essential care plan, a balanced care plan, and a secure care, which is basically bronze, silver, and gold. And then we also have a Medicare health plan called All Well from MHS, and that's where we have our HMO and PPO plans. So next I'll go into some of the benefits that we have for our Medicaid specific product line. So here I'm talking HIP, Hoosier Healthwise, and Hoosier Care Connect. And so we do have a member connections team. So this is a team of certified community health workers that are dedicated to removing barriers for our members. We can be seen in person prior to COVID, but we would be in person. We can help over the phone. The objective here is to help you build a relationship with your doctor, understand your health benefits, and get you in touch with any community resources that you need. We also have a rewards program. So we like to reward our members for taking preventive care measures. So again, this is what their card will look like. They have to do something in order to trigger the card to be sent to them. But our My Health Pays program allows you to earn dollar amounts to be loaded to this card that they then can use at Walmart. They can pay utilities, they can pay for transportation if they need to, child care services, rent, wherever they can use a Visa card, they can pay for those things. So we also offer free transportation. So for our HIP and Hoosier Healthwise members, they can get unlimited free rides. For our Hoosier Care Connect members, there is a small copay, but they can get rides unlimited to their doctor, dental, vision visits, if they need to go to the pharmacy after a doctor's visit, if they have any WIC appointments, any of our MHS special events. So you'll hear a couple slides down of all the events that we host for our members. We provide transportation to those events as well. They can always call our member services line to schedule that transportation. We just ask that they do it at least 3 days before their appointment. We offer language assistance, so it is available 24 hours, 7 days a week, including holidays and weekends, in 150, more than 150 languages. So if we have members that are ever at a doctor's office, they are required to provide language assistance, but if they are unavailable for any instance, they can always call us and we can get that set up for them. We have our free cell phone programs. So we do have two programs. One is Connections Plus and one is SafeLink. Connections Plus is basically for any of our members that are in case management. They're able to have this phone. SafeLink is the federal program. So we just allow qualifying members to receive monthly cell phone minutes in addition to data. And then they also can have unlimited texting with both of those programs. So we want to remove that barrier of having to pay for a cell phone bill or anything like that. We'll provide these cell phones for them so that they can have that communication with their doctors and make sure that they can set up any appointments that they need to. So next I'm going to talk about our website. So our website is very useful, beneficial. There's tons of information on here. So we like to encourage our members to use it, but we also encourage our community partners to use it as well. On there, they can complete that health needs screening as a member. Again, if you do it within the first 30 days of joining, they get $30 on that My Health Pays rewards card. If they do it within the 90 days of joining, then they'll get $10. But they can view their benefits, they can find a provider. MHS likes to be in the community. So pre-COVID, we were doing like 600 plus events as an outreach team. We would put all those events on this calendar. That way you can meet us in the community if they have any questions and want to talk physically with someone. We also have a health library where you can get tips like sheets, and then you can also, the members can also create a secure member portal. So this is an opportunity for them to have a portal where they can go on, see their benefits, pay their power account contribution, change their doctor, whatever the case they would need to potentially contact us for. There are some things in there that they can do so they can avoid having to call member services. The only requirement is that they have an email and that they have access to the internet. So we host member advisory council meetings, and so these are our MAC meetings where we invite our members to come voice their suggestions and concerns that they may have with MHS, in addition to educating them on the benefits and services that we offer to them, in addition to educating them on community partners that we work with. We have a Start Smart for Your Baby program and a special deliveries program. And so these are care management programs for our moms who are pregnant. They are designed to match a pregnant member with an OB nurse care manager that can help them make sure that they receive the proper care throughout their pregnancy. So listed there, those are some of the things the nurses can assist with, help you understand what's happening with your body, talk about what to do if you have complications, help you quit smoking, and all other things. And then additionally, by participating in either of the program, the members are able, again, to receive My Health Pays rewards. So we have baby showers, and so these are fun. They're exactly what they sound like, typically 2 to 3 hour events. We invite our members. We shower them with education. We feed them. We play a couple games. And so it's just a chance to, celebrate them and whether they're pregnant or recently delivered. But then addition, provide them with some education on prenatal and postpartum care. Their first year life program, making sure that they're getting their baby in for their immunizations, and then providing them with information on the OB case management, behavioral health services, and then the rewards program as well. So we have a Children with Special Needs unit, and so this is just designed to support coordination of care for children with chronic conditions, such as the ones listed below. It's a dedicated team of doctors, nurses, social workers, and care coordinators that can help the children enroll in these programs. So next I'm going to go a little bit, this is more focused on the marketplace, so And Better from MHS members. So And Better, these are just a couple highlights. We have a diverse portfolio for our customers. They do get annual wellness visits, screenings, and immunizations that are covered. They also have a rewards program. There's a 24/7 nurse advice line, and then they have the option of adult vision and adult dental on some of the plans. So again, this program is going to be very similar to the Medicaid program. So they will have a welcome survey that they can only complete online. They'll get $50 for doing that within the first 90 days. They get $50 for their annual wellness exam, and they'll get $25 for their flu shot. And so the wellness exam and the flu shot are annual rewards. So we do encourage them to keep that card. The card must be activated online, and then the benefits will begin with the plan, and then they will be mailed automatically again when they complete that first reward. So again, members can earn rewards for healthy behavior, such as getting the annual flu shot and physical. They should use in-network providers. The balance is expire and the cards are closed after the member leaves. The rewards can be used to pay premiums, deductibles, co-pays, and monthly bills, such as utilities and childcare. And then all earned rewards are loaded onto the card automatically and should arrive about 2 weeks from the timeline that the first claim was paid or they completed their first activity. So we'll dive deeper into Medicare just a little bit because I am not our Medicare expert, but I did want to provide you a little bit of information about it. So basics, there are Part A, B, D, and supplements such as an employee retiree plan or an individual Medigap plan. All Well from MHS is a Medicare Advantage plan. So that means that we have replaced Part A and B to be Part C, which is the Medicare Advantage plan, and it could potentially include Part D. So again, this just shows you, just in case you're unaware, kind of what those parts cover. Part A is going to be your hospital services. B will be your doctor visits and ER care. C is that Medicare Advantage plan, which is where All Well from MHS sits. And D is your covers prescription drugs. So again, who's eligible, 65 and older, those that are disabled, and then any persons of any age with end-stage renal disease. So this is just a little bit about what the coverage looks like for our All Well members. Again, not the expert in All Well, but we do offer HMO PPOs and HMO DSNP plans. It shows you some of the coverages there. We do have a quarterly over-the-counter benefit where members can fill out or put in an order for certain things, anything from toothbrush, toothpaste, blood pressure cups, whatever the case may be. They can kind of submit that order quarterly and those items will be sent to them. And then we started serving Medicare Advantage members in 2018. So briefly, before we go into working together, I wanted to just address some of the questions that were stated in the overview. So again, Rachel touched on it briefly as well, selecting the best MCE. So if you are just unfamiliar or the member is unfamiliar with what MCE they would like to choose, I always encourage them to start with their provider. Just as Rachel said, we want to make sure that if you're seeing a doctor already, that they're in network and that you can continue to see them. So you want to make sure you're paying attention to provider choice. You want to make sure you're paying attention to location, and then the plan, benefits, and coverage. So all four of us have went over, some of the ins and outs that our company provides for our membership. And, if something stands out to them that they really would enjoy doing, then that, we encourage them to base their choices off of that. Examples of when to contact us. So members can always contact us no matter what they need. So just some examples: if they want to change their provider, if they have questions about their plan, if they're interested in case management, basically anything I talked about today, they can contact us. But then they can also use that secure member portal if they have any of those questions as well, or our website, because it is plenty of information on there as well. And then as far as prospective members, so maybe they're not with MHS yet or any MCE, and they are looking to enroll or learn more information, we would just encourage them to continue to utilize all of our websites. And then if they need help enrolling, I think one of the other MCEs mentioned navigators, utilizing wherever they may be. Some of them are in, health centers, or, you have CKF and things like that. So I would just encourage them to utilize them as well. So I just wanted to briefly go over some of those touch points for the questions that were asked. But as far as working together, we are an outreach team, just like the other MCEs. We're out in the community. We're always trying to meet our members where they're at. So if you're interested in having us at certain events and activities, we are definitely here to serve. All of the information that I went over today, for the most part, is in a brochure. So if you're interested in receiving brochures for your facility, you can email us at communications@mhsindiana.com, and we can get you a provider order form. That form can also be found on our website as well. And then I personally fill those orders, so I will make sure that they get out to you. And then in regards to contacting us, so we are a team of 4. So we are divided across the state. So Christy Burgess is our Fort Wayne. She's based in Fort Wayne. She has the raspberry color part of the map. And then we have Juana, who is based in Elkhart, but she takes care of the left side of the state. So they are HIP and Hoosier Healthwise focused. So if you are in need of questions about membership or things like that, have a client, these are the people that you would contact in regards to HIP and Hoosier Healthwise. And then Carmen just recently switched over to Hoosier Care Connect, and it's just Carmen right now, so she does have the whole state. So if any of you have questions about Hoosier Care Connect, she would be your contact for that. And then lastly, this is just information. This is my information, member services information, or anything else that you may need. Again, I didn't say this at first, but I am Ambetter focused. So that is, if you need anything, have any questions about Ambetter related stuff, I would be your go-to for that. And I do cover the whole entire state when it comes to Ambetter. And then if you have anything where you need us at community events or things like that, you can send those things my way as well. But thank you so much for having us. I look forward to seeing what questions you have. I'm going to go ahead and put my information in the chat as well. So thank you.
Thank you, Jessica. I appreciate that very much. I do have one question that I would like to pose to all 4 of you, and then we can take questions from attendees as well. But could you speak to, each of you maybe speak to any concentration of providers or pharmacies geographically within your respective MCEs? Because I remember which one of you spoke about to understand what your provider accepts. So I just wondered if there was any kind of concentration of providers and or pharmacies within your respective plans.
This is Rachel with MDWise. We are covered throughout the whole state, and we contract with pretty much all the providers in Indiana. So if you're here in Indianapolis, Eskenazi, IU, all the big hospital systems throughout the state, we are contracted with. And then our preferred pharmacy is Walgreens for our members, and then also those specialty pharmacies that are in the smaller towns that don't have a Walgreens, but that Walgreens is our primary pharmacy.
Thank you, Rachel. Any others?
Say,
So go ahead,
Jessica.
Go ahead, Jeff.
Go ahead.
Okay, so it's kind of same as Rachel. We do cover the state. So we have a plethora of providers, and I apologize, I don't have like our for sure providers. I know Central, because that's where I'm at. We do work with like IU Health and things like that, and HealthLink, some of our big time providers. But I'm pretty confident in saying if there is a very well-known large provider in your area, we are more than likely contracted with them. But we do have a team of provider relations that work on contracting with providers all the time, and that is their job. So if there is a provider that we're not contracted for any reason, you can always reach out and we can connect you with that provider relation to make sure that we get that provider in network. And then our preferred pharmacy would be CVS, but we do work with, are contracted with other pharmacies as well.
Thank you. Jeffrey?
Same. I think we have all over the state, all of the major providers are going to be contracted with us. I think it'd be odd if I found somebody who didn't. Sometimes there's certain doctors that may or may not know if they are. And again, yeah, you can reach out to us. We can get connected to provider relations to make sure. If a member is curious, they can hop onto the website and search for their doctor, and it'll tell them right there. So it's pretty accessible to find out whether or not your doctor is in network.
Great, thank you.
So, and Katie just touched on it, and I saw Jessica and Rachel both nod their head. So all four of the MCEs will all have some type of a find a doc tool that's on our website. So if you do have a specific provider, you can always go there and check. I'm going to say the exact same thing that they did. We have hospital networks around, we have doctors, providers all around. And then our preferred pharmacy is CVS, but it really is, and I'll kind of address this, and I don't want to speak for the other three, but it is an ever-changing. Providers retire, contracts are redone, whatever it may be. So even though it's listed on our website, always call and confirm. It's just a good piece of advice to call and confirm. And then you know, for CareSource, we do have our marketplace and we do have our Medicaid. So they need to call and ask if they accept CareSource Marketplace or if they accept CareSource HIP or Hoosier Healthwise. And that's going to be the same for MHS. I know, and I can see all three of them nodding their head. So we do, all four of us really do try to keep up to date, but it is important to call a provider and just make sure.
Thank you all for those responses. I'm not seeing any questions in the Q&A or the chat.
I just want to address really quickly, Kathy. If everybody could, I have shared the link for our post-session survey. We'd really love to get more information. We're trying to always improve our lunch and learns, and it really is quite quick, less than 2 minutes for most people. So please take a minute to fill that out. And then I did see somebody request whether the presentations will be available. And Kathy, I know you told them we will have it on our YouTube channel later this week, and it will also be on the CKC team's website as well. But I also know that all of our presenters today have shared their contact information. I strongly suspect if there's one that you'd really like to have a copy of, or all of them, if you just reach out, and I see them all nodding their heads, they'd be happy to provide you PDFs of their slides as well.
Well, can I just interject? And I will pretty much speak for all four of us on this one. We do presentations for providers, for navigators, for whatever your group may be. So if you do have questions, please reach out to all four of us, and we'd be happy to do a presentation, happy to answer whatever questions you may have. So I got that for us, everybody.
And if I could, I would like to thank Kathy Walker. I'm her supervisor technically. And this whole webinar was her idea. And I am so grateful that she thought of it, because we've had our best attendance on this webinar than any others we've put on to date. So that tells me that your information is really important to people. And so I want to thank Kathy for her efforts. She produced the whole thing. All I did was show up. It was an easy button for me. So thank you, Kathy, and thank you all for joining us here today. We can stay on for a few more minutes for additional questions if needed.
Thank you, Tina. I'm going to also mention Carolyn Miller, because she's the one that's done a lot of the behind the scenes work here and putting all these pieces together and sending out the links and whatnot. So Carolyn, thank you for that effort. Appreciate it. And thank you, Tina.
And thanks, Allie, for the opportunity to present on your lunch and learns too, because without these, we wouldn't be able to utilize this as efficiently as we do. So I think we've covered all our bases. Thank you.
So I'm not seeing any more questions come in, and it looks like people are starting to pop off. So I just want to thank everybody for joining our Lunch and Learn today. Again, everyone has shared their contact information in the chat. Oh, and we have a Q&A that has just come in. Do you all have
Yes.
specific DME providers that you work with?
So I'll start because mine's super quick. I know we have some providers. I'm just now starting to get in on the vendor kind of contract side in my current role. I don't have the specifics, so I believe it was Pam. I'm sorry, I closed the window out. But Pam, if it's a certain reason you're asking this question, feel free to email me, and I can move that over to that department and see who we contract with.
And for MDWise, you can actually look up that information on our Find a Doctor on our website. You could just choose, instead of finding a provider, PMP, or specialist, you can choose a DME provider in the area that you're searching for, and it'll pull up a list of the DME providers we do have in network. Or also, you can always as well reach out, and I can connect you with provider relations, and they can get you get that information for you. So I cutting out.
And I'm in the same boat. I know that in the past, when I've had to use DME, depending on the region that people are in, I've had to use national. So some regions, I'm not sure if I do have a local DME. But if you do have a question, please feel free to reach out, and then I will be happy to take care of it and get that information.
Just because we do have a good attendance, could someone define DME? What's that acronym? Sorry.
Durable medical equipment. So like your CPAPs, or there's a ton of different things, but just
Breast pumps.
medical equipment that you need, new supplies every month or 2 months.
Great. Thank you so much.
Yeah, it's the same for us. Sorry. And if somebody, yeah, I mean, it's largely the same. I would just encourage people, if you leave with nothing else today, the contact information, because any question you have is going to depend on where you are, what's going on. And so I want to make sure that you get the right answer and get to the right person. So.
We are bumping up against time, but we did have one more question. It might be kind of specific, but this person says, I help members set up transportation a lot of times, and I often see transportation canceling at the last minute. Can you talk about this and what members can do if it happens?
It happens.
Yeah, it happens. And transportation is tough. I don't think when we started providing transportation, anybody could have anticipated just how much need and the logistics on that. We have tried to adjust and do some things, differently. Bottom line, if somebody has a complaint, please let me know, because we do keep track of those, and that's how we determine if we renew with vendors or not. We do, on all of our transportation material, ask people for 2 business days. And then we've also offered reimbursement for people who have friends who can give them a ride. We will provide gas cards for folks who are in rural areas. So there's several different things that we're trying to do to kind of alleviate that.
And that is, you can actually get credentialed as a transportation provider, I believe, through the state's website. I don't have that link off the top of my head, but I know I've used that in the past. And Kathy, I can dig up that link for you, send it to you if you want to send it out to the attendees, because we are at time. So, but I'll try to help with that.
Thank you.
Yeah, I would just confirm, like, definitely letting us know as that whatever MCE they're with and they've scheduled that transportation with, especially with them canceling last minute, right? It sounds like they're setting up the transportation and then it's like, oh, I can't come pick you up today. And so we as MCEs do not know that unless they come back and say, hey, I had transportation today. I've had someone call me, unfortunately, and say that they had scheduled transportation 3 times after being canceled the first time, and transportation canceled or didn't show up or whatever the case may be. And the only way we found out is because they told us. So don't ever feel like you are being a burden or bugging us too much because you're telling me every single time. hopefully it decreases, but you're telling me every single time that they're canceling transportation on the member, because we'll never know if we don't find out. So I would just encourage them to continue to contact their MCEs and let them know as well.
Okay, well, thank you everybody for attending today. Thank you to all of our panelists. Very good information. Just hope everybody has a great afternoon.
Thank you.